So the next and final energy modality I'm going to talk about is pulsed electromagnetic field therapy. I'm going to refer to it as PEMF. I got introduced to this. I took some courses in functional medicine, and there are some people talking about it. And then I had some patients talk to me about the BEMER. Have you heard about the BEMER? I'm like, yeah, it's a car. No, they said it's a PEMF device. Who's heard of the BEMER? It's probably the most known PEMF device out there. And then I found a book, PEMF, The Fifth Element of Health by Bryant Myers. Very nice book. I strongly recommend it. If you're interested, read his book. It really changed my way of thinking about energy medicine. And he talks about the 5 elements of health, which is food, water, sun, oxygen, and akasha, ether, or the Earth's natural PEMF. So the Earth has natural pulsed electromagnetic fields going through it. And it actually affects our physiology. It affects our heart, it affects our brain, and it affects our bones and our muscles. It actually really determines how we function. So much so that when the astronauts went out to space in some of the earlier flights, they would come back fatigued and in pain and just feeling very lousy. And their bones would, density would go down. So nowadays, NASA actually has PEMF devices implanted in their suits and in the spaceships to help them feel like they're at home. And they come back and they're not as fatigued. They're not feeling so miserable afterwards. So what are the benefits of PEMF? Recharges the transmembrane potential, increases ATP. Right, here's another energy increase from another energy modality. Enhances our sodium-potassium pump, increases cellular pH, so you become less acidic, increases oxygen uptake, lowers your blood viscosity, improves circulation, and improves electroporation, so the nutrients can get in and out of the cell. These are all great benefits just from a naturally occurring phenomenon, which unfortunately is slowly declining, and is also getting, we're getting a decreased amount of the pulsed electromagnetic field from the Earth because we're getting all these other electromagnetic fields from all these different antennas, cell phone towers, and everything else. It's polluting our world quite a bit. So PEMF promotes healing in bones, cartilage, tendons, ligaments, muscles, skin. It decreases pain, reduces inflammation, improves physical function, and improves recovery. And I can attest to improving recovery. So when I was a kid, I used to do Taekwondo, and then I stopped for about 20 years. And then my son started doing Taekwondo. So I decided, hey, I'm going to go to Taekwondo class with him. But the only day I could go was on a Saturday class. And the Saturday class, I don't know if anyone has ever taken a Saturday Taekwondo class. These are intense classes. This was a 2.5-hour intense class with lots of sparring and lots of workout. And this was my first class after 30 or 20 years of not doing Taekwondo. But I needed to show my son, hey, I can do this, right? I can support you. So after the class, I told my wife, I think you have to drive the car. I don't think I can drive home. I could barely move, okay? I come home and I could barely move. I'm eating lunch and I'm like, oh my God, I'm hurting so bad. Every one of my muscle was hurting. So I got on my PEMF device. I laid on it for about 30 minutes. I felt a little bit better. Then I got the pillow that I have in my PEMF device, and I treated my quads, then I treated my legs, then I treated my back. And after 2 hours, I finally got up. I'm like, okay, and I felt great. And then the next day, I was just a little bit sore. And then Monday, I come in to drop off my son to Taekwondo class, and the teacher's like, so how you doing? Well, I'm okay. I'm not hurting that bad. Because I did tell her I use my PEMF device. But if I didn't, boy, it would have been a rough week, probably. So PEMF not only helps us recovery after Taekwondo, but it helps with wound healing. It augments endogenous electric fields. It increases proliferation, again, of the fibroblasts, increases collagen synthesis, increases angiogenesis, and decreases inflammation. And again, lots of studies, this is just one of them, looking at chronic wounds being treated by PEMF in 31 subjects with full thickness leg ulcers. 18 got PEMF, the other 13 got sham. 3 hours a day for about 8 hours. So they actually got a device they got to wear and take home. So they were looking at wound depth and wound area. And on the graph on the left, you can see week 0, here's their wound area, and then after 8 weeks, their wound area decreased significantly. The sham, unfortunately, didn't do so well. And the same thing with the depth. It significantly decreased. So Nowadays, PMF is even used right after surgery, post-op wound healing. Here's one, the plastic surgeons got really smart. They're using it on their post-breast implants surgeries. You can use it on thoracotomies. And it does stimulate healing pretty quickly, but it also decreases their pain. It decreases post-op pain significantly. This is a study looking at women after breast implant surgery, and some of them wore real devices, some of them wore sham devices, and their pain significantly decreased. Their healing significantly decreased. There was less wound exudate volume, less inflammatory markers in the wound exudate. It can also be used for ligament healing. And here we go again with the veterinarians. They're a little bit ahead of us, unfortunately, when it comes to energy modalities. It is commonly used in horse medicine and all kind of veterinary medicine. Here's a veterinarian using it on ligaments of the horse because it stimulates fibroblasts, collagen production, decreases inflammation, increases tensile strength of the ligaments. Here's a study looking at patients with resistant rotator cuff tendonitis, 29 patients, 3 months rotator cuff tendonitis, resistant to all other treatments. Therapy, injections didn't help them, so they decided, let's do some PEMF. They had PMF devices put on them for 5 hours a day for 4 weeks. For the first 4 weeks, we had the sham, and then you had the experimental group, and then the research group was very nice. The next 4 weeks, they let the sham patients get the real device as well. And you can see on these graphs, their pain significantly decreased, and then the sham, when they got their device, their pain significantly increased. Their movement, range of motion increased significantly without pain. Sham didn't do so well for 4 weeks, but then when they got their real device, it actually helped them as well. There's studies looking at lateral epicondylitis, again PMF versus sham, for 30 minutes, 5 times a week for 3 weeks, and then they were evaluated 3 weeks afterwards and 3 months afterwards. And again, you can see that the patients who got the real device, their pain significantly decreased afterwards, and even 3 months afterwards. So there's long-term effects. So this wasn't just a pain modulating effect. This wasn't just, hey, we're just blocking the pain. These patients actually healed because 3 months later, they had improvement still. The screen went off here. AV person, please. The other thing that works, that PMF works for, is bone stimulation. And this is probably the most known area for post-electromagnetic field therapy. Who's heard of bone growth stimulators? Right? Everybody has heard of bone growth stimulators. Well, PMF stimulates osteoblast proliferation, increases growth factors, increases alkaline phosphatase, and enhances bone marrow stem cells. Thank you. So this is some old studies kind of got this whole bone growth stimulated started. So this started with the tibial non-union fractures. These are patients that just their tibia bone was not healing after 4 months or even farther. So half of these patients would get PMF, half of them didn't. And again, these are very dire cases. After PMF, some of them got to full union, another group got to probable union, while the sham group didn't do so well. And here's a picture of, again, the tibial non-union fractures are very difficult to treat. As you can see, these are very hard to put pressure on and put weight on. But these patients would actually heal and improve. And that's why nowadays PEMF is FDA approved, and it's actually insurance approved for non-union fractures. It's also approved by the insurance for lumbar or cervical post-fusion healing. Because of these studies. And I love this. This is a comment by the surgeon that did this study. The effectiveness of bone growth stimulation with PMF is established. This is a typical, comment from a spine surgeon that basically what they did was they took 195 subjects with interbody lumbar fusion, and half of them got PMF, half of them got sham, or shaft. I guess they did get shaft. But they didn't get the PMF, and then they want to see how many actually of them have complete fusion. And the patients with PMF group, 93 to 91%, up to 92% of them had complete fusion, while the shafted ones only got 67% of them. So again, pretty good, big improvement in their healing. And again, after a spinal fusion, this is a pretty big deal, right? These patients told, don't take any NSAIDs, be careful with your exercise routine and your movement, because we don't want those bones moving out of alignment. Well, this can help them as well. This can help them fuse and make sure that they succeed. And like I said, we used to work at the spine center, work with the spinal surgeons. We see this all the time. It's been studied for osteoporosis. Low-frequency PMF relieves primary pain of osteoporosis. And I'm thinking, what is primary pain? There's no real pain with osteoporosis. They were referring more to fractures. So when you have a fracture after osteoporosis, that is pretty painful. Who's had patients with compression fractures? These are miserable, right? Very miserable. And I have actually several patients with compression fractures who just weren't healing. We got them to actually rent a PMF device, and some of them ended up buying one. They're not cheap. They're $3,000 to $5,000. And they put their devices on their back, and within a week or two, they come back, I have no more pain. I'm like, okay, let's keep on going. And they speed up their healing, and they come back 2-3 months later, they're completely healed, and their pain is completely gone. Very effective for pain from osteoporotic compression fractures. And it may be effective for preventing bone loss. There was a trial in 2013 that looked at PMF versus alendronate, and they found it to be as effective, but didn't come with all the side effects. So these patients would lay on a PMF med daily, twice a day, and the other patients got the pill. And their results were almost the same, okay, but without the side effects. So I usually tell my patients, as one of their ways to help their bone health, I do recommend PMF or some form of energy modality. It's been studied for arthritis as well. It increases proliferation of chondrocytes, growth factors, collagen 2. It stimulates synthesis of proteoglycan like hyaluronic acid, right? You guys heard of hyaluronic acid? It's what we inject in their knees. Well, you put a little bit of PMF and it stimulates its endogenous production. Or what I do in my clinic, I may inject their knee with the hyaluronic acid or platelet-rich plasma or something, and then I use that PMF device afterwards to stimulate it even farther. And these patients do much better than just the injections alone. Here's a nice study looking at guinea pigs exposed to PMF. Thank you, AV person. These guinea pigs are genetically susceptible to developing osteoarthritis, usually at 12 months of age. So they took these pigs, and half of them got PMF for an hour a day and the other ones didn't. And then they kind of followed them to see what happens to their cartilage. And on the graph of on the table right here, on the left, you can see these are the patients or the pigs that did not get the PMF. And here, the pink is the actual cartilage. So these are some of the moderate cases that they found. These are some of some more severe, and here's the severe where the cartilage is completely gone. But now all the little guinea pigs that had PMF performed to them, their most severe cases still had significant cartilage over the bone. So these pigs were actually preserving cartilage. So this is a meta-analysis of randomized controlled trials published in 2009 in the Journal of Rehabilitation Medicine. And it states PEMF fields improve clinical scores and function in patients with osteoarthritis of the knee and should be considered as an adjunct therapy in their management. Again, adjunct therapy, this is not the cure for all, but it can help if you're still doing the right diet, the right exercise, and utilizing mental well-being. Here's one of those randomized controlled trials. Patients wore this little device for about 15 minutes. AV person, you're still teasing me with this screen. It goes on and off, on and off. So they wore this device for about 15 minutes, twice a day. And pretty quickly, within a couple days, their pain significantly dropped. And as long as they were using it, it was decreased more than 50% on a daily basis. And all it took was a 15-minute wear of that device twice a day. Here's another study looking at patients with cervical osteoarthritis laying on that mat. That's the kind of the mat that I use in my clinic and at my house after Taekwondo. This is 34 patients who were divided into PMF versus a sham. And 30 minutes twice a day is what they pretty much treated themselves with. And they wanted to look at the pain and the cervical range of motion and neck pain disability score. And the patients, as you can see on this chart right here, the patients with PMF they're significantly changed. So their pain levels from 6.9 to 2.5, that's a pretty significant change, while the sham from 7 to 6.7, not a huge change. Their range of motion increased significantly, and their neck pain disability score decreased significantly. In our clinic, we use this quite a bit. I have patients with, like Mr. R, he had a lumbar radic and knee arthritis, and he's tried steroid injections, and he has diabetes, so his steroid injections would increase his diabetic or his glucose measures significantly. He was miserable. Nothing was helping him. He did therapy. We did some injections. He finally purchased one of these devices, and then 2 weeks later, he calls me up. He's like, "Doctor, everything is worse. What's going on?" So I'm like, well, what happened? What are you doing? What he ended up doing, he took the device and increased it up to maximum level and was using it 3 times a day for like an hour each time. So he was overexposing himself. So we said, why don't you bring it down to significant lower levels. And then I saw him in clinic 3 weeks later, and he's like, yeah, my pain is gone. My radic doesn't bother me. My knee is okay. I can go on trips, and I don't have any issues. I have another patient with sacroiliitis. She had miserable pain. This is a young lady who actually wasn't able to go to school and wasn't participating in sports because of the pain. She did physical therapy, she did a shot, she did a laser treatment, and nothing was helping her. Then she ended up renting one of these devices, and 2 weeks later she came in and she was pain-free. It was amazing. Not that all of these patients come up with these amazing results, but this one was. And I do see a lot of patients with EDS. Who knows what EDS, Ehlers-Danlos syndrome? It's a hypermobility syndrome. These patients are miserable very often. A lot of pain in their joints and muscles. I have quite a few of them on one of these devices, and boy, their life has changed significantly. They just treat themselves every day, no side effects, but they feel much better. The only contraindications, they cannot use these devices if they have any implanted electric devices or if they have seizures or if they're pregnant. PMF helps with nerve regeneration, increases regeneration maturations of myelin, of axons, stimulates blood flow to the nerves, decreases nerve scarring. There was a study looking at patients with radiculopathy. They wanted to look at their pain level and the electrodiagnostic studies afterwards. And in this study, patients who got PMF, their pain significantly improved. Their modified Oswestry score, which is their disability score, significantly decreased. But not only that, when they did somatosensory evoked potentials to check how well their nerves are conducting, their latency improved significantly. So their nerves were firing faster. Their amplitude significantly increased, so they had more axonal growth. Here's another study looking at patients with severe neuropathic pain from all these kind of cases that these patients were given up on by their physicians. These are patients with CIDP, inflammatory, with pernicious anemia, mercury poisoning, severe neuropathies, significant pain, and nothing was helping them. So these patients got 9 consecutive treatments for 1 hour at a time, and after the treatment, they had about 21% average pain reduction. And then 30 days later, without even a treatment, they said about 49%. So very effective. Here's one of my patients, Mr. D. He's got CMT type 1, which is a demyelinating hereditary disorder. He has a lot of numbness, twitching, tingling, tightness of his legs. He came in originally, he's like, my legs feel like someone's squeezing them. He has a lot of weakness, and nothing was helping him. His neurologist told him, well, we'll see you in the year, and we'll repeat your EMG, and we'll see what happens. Nice, but there was no treatment there. So he came in, and we designed a nice comprehensive treatment plan. Again, a comprehensive plan, which included a mitochondrial diet, specific diet to help him stimulate his mitochondria, specific pool exercises. We use some turmeric and some fish oil to stimulate the myelin growth. We work on his positive outlook, and then he had PMF twice a week for 32 minutes. And here he is with his thumbs up, because after 3 weeks, he's already telling me he's got less numbness, less squeezing, less twitching. He's very happy with this treatment, and I have a feeling he's going to do this for quite a while. And you know, he's satisfied, and I hope that you find other patients that can say the same to you if you indulge in these modalities.